fitness is freedom and I won't stop until every woman breaks free. So hi Alisha, thank you so much for joining us today. Tell me, why physiotherapy?
So physiotherapy definitely it is due to my mom. My mom wanted
Oh,
to
because
see
of
me
your mom.
as,
Okay.
Yeah, my mom wanted to see me as a doctor, and I was like, okay, let's be a doctor. But the thing is more of like it is related to my history of like I
Okay.
met with an injury.
What happened? Can you tell us a little bit about that?
Yeah, I met with an injury. I had a ankle fracture that time, ankle injury. I twisted my ankle that time. I met with like complete left side. I was having a major injury.
Okay.
And that time I was not able to walk for like complete 1 year.
Okay.
And I was completely bedridden for that time.
So how did you get out of it then?
Definitely I took physiotherapy.
You took physiotherapy, okay.
So
So was your personal experience one of the reasons why you took up physiotherapy?
Yeah.
Okay. So there are a lot of budding physiotherapists out there. What advice would you give them?
So definitely it's a lot of hard work.
Okay.
It's a lot of sleepless nights you have to go through.
How long is the course?
4.5 years.
4.5 years.
Yeah.
And how was your 4.5 years?
It was actually I will say it a complete roller coaster.
Roller coaster. And why is that?
There's sleepless night. You have to study a lot. You have to learn things from the basics to the premium level of knowledge. And
Correct.
it's like you have to know every single thing. And because like as being a doctor, that every day it's not the same thing gonna happen. It's
Correct.
more of like a complete human being is gonna come
And
to
anything
you.
can come
Yeah,
up.
anything can come
So
up.
what made you push through the whole journey,
Of course, the journey I went through, like the time I've seen my patients and seen them recovering from zero to hero, I'll say.
Okay.
So that is completely a satisfaction.
Okay, so the joy of transforming your patients
Yeah.
is what makes it worth it in the end, right?
Yeah, that's
Can you
right.
give us a specific example of anything that like you remember?
Yeah, so specifically I love pediatric sectors.
Okay.
So I'm working in pediatric sectors for more than like 3 years. So I've seen patients from like where the child is not able to even crawl, is not able to even lift his head.
And this is like at 1 year old or like even less than that?
Yeah.
Okay.
Even less, more than that as well. When seeing 5 years old child is not able to lift his head, he's not able to crawl, he's not able to walk.
And what was that journey then?
That's the perk of it. You see that improvement in the child. You make that happen. You make that happen. That is the biggest accomplishment of mine.
And that's what makes that 4 years or 4.5 years
Yes,
worth it.
yes.
All those struggles and those sleepless nights.
Yeah,
right?
yeah, that's worth it. That's whole and soul are worth it.
Amazing. You mentioned you deal with a lot of kids, right?
Yeah.
So what specific issues are kids facing these days?
Yes.
And how do you deal with them and how do they recover?
See, I have seen as a person like lot of ADHD and autism is increasing in the kids right now. Do you know that if there was a phase, we say COVID babies.
Okay, yeah.
There was a phase COVID babies, and wo time pe the kids was not able to speak much. They were not able to socialize much. So because of that reason, also the child has become autistic.
Okay. And can you tell our audience what exactly happens in autism?
See, autism and ADHD is one of the neurological condition, and what happens is like their sensory dysfunction happens, their speech get affected, there is a developmental delay, their fine motor and gross motor's delayed development happens.
Alright.
So in that, more of like kids can be very hyperactive, they are like not listening to anyone. There are a lot of sensory issues also happens, more like sensory issues like child is not able to know the touch sensation, smell, or completely extremely hyperactive. So these are the few symptoms, and they're like much more of it.
Okay. So, and how do you deal with them? Like what kind of workout is prescribed to them, or what is done exactly?
See, of course, we go with the complete examination of a child. What is happening there, and like lot of questionnaire, lot of examination happens to the child, and more of like a pediatrician is able to tell that what exactly happens to the child, and the whole protocol happens through the physios, OTs and PTs.
Okay, so what's the protocol that's followed, like when you're trying to recover, say, a child who's suffering from autism?
Yeah.
What is done?
So in autism, there is of course a lot of approaches we try to use it, a lot of techniques we try to use.
Can you tell us a little bit about those techniques?
One technique I prefer to use more is like sensory integration.
Okay.
That we can do more of like NDTs, there are a lot more approaches. There's one of the like 2 prime approaches which we use.
Okay.
Sensory integration. So there's a lot of dysfunctional happening where a child very hyperactive.
Okay.
Or sometimes there's also chances where his child is completely hypoactive.
Oh, okay.
So child is not talking, child is not active, child is not communicating, child is not socializing. So that this thing.
So how do you work with such a child?
It's more of like, of course, if there is a child, we have to make it a playful approach.
Okay.
Yes, one of the thing, and more of like we have to work on their sensory issues. So all the sensory integration, it can be a vestibular, proprioceptive, tactile, then more of like all the inputs where like child is not having it at that age when we used to have it. So we have to build that up by a lot of techniques.
And is it like a slow process? How long does it take for a child to show real improvement?
See, just say parents able to see that, notice that okay, the child is not able to walk, or maybe he's not speaking, he's not communicating, he's having some issues, he's touching lot of things, smelling lot of things, or like completely going here and there, back and forth, jumping here and there.
Yeah.
So these are a few symptoms you can see. More child likes to use hanging and all. They like the more like of it. So if that is a vestibular seeking. We say the child is completely hyperactive all the time. That is a vestibular seeking. Proprioceptive seeking.
Okay.
There is a lot of seeking happens, and there is like more of like sensitivity as well.
Okay.
These kids also get sensitive to even slight touch or a slight hug as well.
Okay, so how, like when you start working with such kids, how long does it take for them to, start showing some signs of improvement?
It gradually increases, it gradually take time. So we have to be a goal oriented, what exactly happening in the child. There's sensory dysfunctions, I've told you. So there are 8 senses, as you know, which we can see, and 2, complete 8, and 2 is like 2 is the one which we can see, and rest are all we feel.
Yeah.
Okay, so we have to observe the child first, like what exactly going on with the child, and then we have to figure out this is he's seeking, this is he's lacking, this he is sensitive about. So that we have to develop gradually.
So on the part of the parents also, there'll have to be a lot of patience involved, right? Because I'm sure these kind of treatments take a lot of time to show results. It's not like an instant thing that will happen in like a month or so, right? So Alisha, tell me, apart from kids, you also deal with adults, right?
Yeah.
So what are the most common mistakes you've seen in your clinics or even at the gym?
So I'll start with the gym. What is the mistakes I've seen? First is definitely wrong forms.
Okay.
That can like repetitive wrong forms can cause it to my clinic.
Correct.
Yes.
So continuously repeating the wrong form is eventually going to lead to an injury.
Yes.
And that's why then you have to visit a physiotherapist.
Yeah. And the other one is definitely running on a treadmill.
Running on a treadmill. Can you go deeper into that?
Yeah. So I'll tell you what happens if you run on a treadmill is completely flat pace. The most chances of you having a shin pain, lot of shin pain you can have, more of tendon injuries you can have, lot of sprain you can have it.
Okay.
If you want to use treadmill, you go with the inclined, complete inclined phase and just go with the fast walking you can do.
Okay.
But don't run on it, more of like because of that reason, that thing causing lot of shin pain in this time.
Okay. So what you're saying is use the treadmill but don't run on it. Either walk on it and put it on an incline. And you can maybe do like a brisk walk also.
Yeah, brisk walk. Yeah.
Okay. And tell me in terms of like warming up, how does that come in the way? Like.
Yes. Also one thing I've seen, third mistakes. Is like I don't see people do warm up. They don't do the stretching. They don't do the cool down.
Okay.
When they're done with the workout. So these are the like complete prime.
Exactly. So tell us, why is it that important? Like what exactly happens when you warm up and you stretch?
See, in warm up, like you asking, telling your body like, okay, now it's gonna be have first warm up is dynamic movement, dynamic things we have to do. So you have to keep your body, you have to do a lot of circulation, then you have to go for the other weights, whether you're doing the weights, whether you're doing other physical activities as well. So all you have to start with the warm up, then you have to go with after the workout, you have to do the stretching, and then you have to do for the little bit of like.
So your warm up basically prepares you for the main workout, right?
Yes, for the main workout.
Just giving your body a signal that okay, now something better is coming.
Yeah.
And why is stretching also very important?
Stretching is what is happening. Of course, muscle is, if you're doing the biceps, you're doing any workout, you're trying to give lot of tension, lot of strain to the muscle.
Yeah.
Okay, so what is happening? Here you're contracting, a lot of contraction is happening.
Correct.
And in stretching, a lot of relaxation is happening, and that is extremely important for the joint, for the muscles, and for the circulating muscles over the joint as well.
Okay.
So it's more of like conditioning your body.
But people at the gym focus more on contraction, and eventually because they end up skipping stretching, there's no relaxation happening.
Yeah, and that is actually the reason of lot of injuries, I must tell you.
Okay.
Yeah. So gym, gym people comes with the same main concern, frozen shoulder they are having.
All right.
Okay, and they are having a lot of.
So just because you mentioned frozen shoulder, what are the main causes behind frozen shoulder?
See, what is happening is a rotator cuff injuries most of the time. Frozen shoulder is somehow like, the muscles over the shoulder joint is not working properly. There's a lot of impingement happening.
Okay.
There is less range of motion happening there. And also there's, if they are also doing a lot of weights as well. So more like pushing pull activities they are doing. After that they need to do the stretching.
Okay.
First, of course, they make you flexible. They make you, you're able to function properly. You're able to it's more of like conditioning your joint. I've told you stretching is one of that reason.
Correct.
All there is like muscle tension. You are reducing that muscle tension strain.
And
for that reason also.
Finally coming to the cool down. Why is cool down equally important? Because most people skip it.
Yeah, that's very important. It's part of it. It's just like warm up, stretching, and cool down. It's just like you're letting your body relax a little bit. Now you're done with the workout. Now you have to relax, and there you are. What you're trying to do is like taking your heart rates go a little slower. What is happening when people skip it? For an example, now my heart rate is normal, I'm fine and everything. Just instantly started pushing very harder. I'm trying to lift very heavy. My heart is not ready.
Yeah.
You cannot my heart is going directly, to the 0 to upscale and coming back. It's like that.
Correct.
That are the reason of lot of cardiac
But how
issues.
specifically does the heart rate come into play when we are talking about cool down?
Yeah, cool down is the thing is like, you're supposed to do it later after the stretching. So somehow you preparing yourself to calm down. It's time to it's over and I have to go home.
Yeah.
It's the main.
So, but what happens when you skip it?
Skip it. It's completely warm. Actually, cool down. It doesn't make so much role.
Okay.
All you just have to relax yourself. You have to rather you don't skip it. It's just like when you're doing it, you're in a peak, you're in a high, you're completely active. Cool down is just taking yourself to relax. You're done with the workout, you're relaxing your muscle. More like a relaxation it is. More like taking your heart rate to the normal pace again.
Just going back to normal. All right, fine. So, Alisha, it's my goal that more and more women start coming to the gym. But I know that, a lot of women are at home, they're in pain, but they're not taking action. So most of them that they come to us, they either have knee pain or they have back pain. So could you tell them why exactly does this knee pain or this back pain start?
See, what exactly happening here when a lady is having a knee pain or anyone is having a knee pain, their surrounding muscles are getting weak.
Okay.
Okay, and one more reason is spur formation.
Okay, what is that? Can you tell us about that?
Spur formation is reducing the reduction in the bone density.
Okay.
It happens after ages, after 30s, after 40s. They experience the more. And gradually their surrounding muscle gets weak. So because of that reason, they are having a lot of knee pain.
So there's a lot of weakness in the surrounding muscles, and that's why the pain starts in that specific place. But why does the pain start?
Because of there's no physical activity happening, you're not strengthening the muscles, you're not eating right, you're not having much protein.
Correct.
So first of all, definitely dietary aspect, and second is you have to make yourself very much strong, have to strengthen the muscles.
So the pain starts because some other muscle starts overcompensating for that weak muscle, right?
Yeah.
Okay. And then when you move to the back, why does back pain start?
Back pain, same. You are not strengthening your back. That's why you are having a back pain as well. And then one more, bad posture.
Bad posture as well.
Yes, if you're not sitting right, that is a main.
Constant slouching.
Yeah, constant slouching. That is a prime reason for it.
Correct.
Yeah.
So,
and of course, weight.
Weight puts a lot of
gain,
pressure on the knee as well, right?
Yes, yes.
Okay. So, I mean, if you had to give one tip, to all of the people out there who are struggling at home, and for some reason they're not able to join a gym,
yes.
how do they get rid of these pains?
See, any physical activity is mandatory.
Okay.
If you can do yoga, if you can do home exercises, body weight exercises, you can do. You can do walking. You can do brisk walking at home as well. All these options are there. If you're not able to come to the gym, you can do this as well.
So what you're saying is start some activity, but
Yeah.
the solution to pain is strengthening that muscle.
Yeah.
And that's how the pain will go.
Yeah, absolutely.
Correct? Thank you. Thank you so much, Alisha, for joining us, and thank you so much for sparing some time
Thank you
for
so
us.
much. Thank you so much for inviting me as well.